Invited guests, everybody took time to honor this occasion. Most important today are our hosts. I'm changing this from mother to people who are making donations. Those are hosts. They are more important today. Sibanye-Stillwater and Old Mutual. Thank you very much. I'm happy that I've been invited to be part of this occasion. It follows a number of unannounced visits to a number of mines, including in this area of Rustenburg. In these visits, Dr. Mkiza, we discovered various levels of compliance, not the same. Many mines do comply up to the level of screening. But when it comes to testing, we found many of them wanting. And when I say that, it's an appeal that help us tighten that side. Because if we don't, we're going to have a false satisfaction that we're making progress. Many mines complain that there's a shortage of testing kits. We nurse them that as an industry, pool your resources together, have area testing centers where you share the facilities and share the resources, but mine workers must be tested. Otherwise, you are risking their life. We're beginning to see an increase in reported cases. As of yesterday, 13 positive cases were reported in the industry. We think that we need to tighten that side of testing so that we don't have false satisfaction. We were dragged to court by AMCO, saying our regulations don't protect workers, and we've passed that test. The court confirmed that if we stick to the rules and the regulations, the industry will be more safer. And that's what I was telling the chief inspector of mines, that when the court says use the Health and Safety Act, it is expanding your mandate beyond what we normally do in the Mine Health and Safety Act. We have urged that at the heart of our programs is protection of lives. Anything else is secondary. And when we agreed that we allow mines to operate at reduced capacity, we highlighted the importance of protecting and saving the economic infrastructure beyond the lockdown period. We accepted being used as guinea pigs for this phasing in of the economy. We looked at a number of companies that are beginning to go under. SAA, you can look at Tsuho-Sanda, which is putting 36 hotels, closing 36 hotels. You can look at Spare, which is closed. There's a long list of those companies. And our view is that as we protect the lives, we have a responsibility to protect livelihoods and therefore protect the economic infrastructure. Of course, the economy is going to decline. Demand is declined. When we don't have load shedding, it's not because there is improved efficiency, it's because demand is low. Demand for fuel is low in pump stations, even when you reduce the price. We understood that it was risky to test the concept of phasing in the mines production. We have a duty, therefore, to succeed. We want the mining companies, Dr. Mkiza, that The biggest disaster that can visit us is when a mine worker goes underground, he tests positive, and we test the crew. We find that crew positive, you see, and we test all the other contacts. We find a big number of people positive, because when that happens, we will be forced to close that mine. Once we find that, the mine will be closed, because we're not going to put people at risk for production. And that has been emphasized over and over. I want you to take that mines appreciate the fact that if there can be such a calamity, that mine will be closed. Lord does give us power to close a mine. Either close it for a period, Section 54, or take the license, Section 47, if a mine is behaving recklessly. Therefore, this provision of PPEs will help us locate mines in communities where they mine. This follows a number of companies that are giving donations. You know, a small black company yesterday donated testing center for Bronco Strait Public Hospital. They are fully equipped. And I say, if mining companies can do that in numbers, we will be part of fighting COVID-19. If we don't want to spend money on the fight, we're not going to be part of the army fighting COVID-19. I'm happy that Dr. Mkhize is here today. I wish you can undertake an unannounced visit to a mine. Just arrive there, check the details, check the procedures, check if they're doing what they have written. And please give us feedback after you've done that. I don't say do that today. Once you have done that, give us feedback. We're a willing force in the fight. We're willing to be guided. The industry is full of engineers and sociologists who are good followers. Sometimes doctors in the hierarchy are not at the top. Engineers don't listen to doctors. They don't listen to doctors. They will have to count that mathematically, how much does it cost and so forth. But please reinforce our doctors in the sector. I'm not accusing you of mistreating the doctors, but in the hierarchy, doctors are not at the top. Therefore, the Department of Health must move closer to the industry, force us to do the right things. We appreciate your leadership in this complex and difficult project. You must be assured of our support. You are doing well. It's a difficult project, and it's not going to go away now. It is going to take time. It's going to be with us for a long time. I can assure you that this country will never be the same again. The economy will never be the same again. Mining will never be the same again. These regulations will be applicable far beyond the lockdown period. I appreciate your presence here, Dr. Mkhize. I'm very happy and excited that you are here. I accept that you are leading this complex project properly and correctly. And you can be assured of our support in the sector. Thank you very much, Mr. Sambata.
Thank you very much, Minister. Thank you very much, Minister. Thank you very much, Minister. Thank you very much. Thank you very much, Marco, for the Minister. Thank you very much. The Minister of Health is our boss and our leader. We call him Mr. Consistency. His nickname. is the consistency. What he says today, he will say tomorrow. What he believes in that must be corrected, he will ensure that it's corrected. With the Minister of Health, I've seen comrades how they money through a mask. What the OP, what national chair OP. Thank you very much. Minister, we not only receiving donations on PPE, that cannot be a confusion. It's our inherent responsibility to provide PPE to employees we employ.
We'll come back to that story as soon as we're able to, about the donation of personal protective equipment. The Minister of Energy there, Gwede Mantashe, and the Minister of Health.